Hi, this is Dr. Wayne Whalen with helpithurts.com. I want to talk to you a little bit about a question I sometimes get from my patients, which is, why do I have to keep coming back? Well, the answer is you don't. It's totally up to you. But if you want to fix a problem that you've had for some time, it's going to take some repetition. Many of the problems that I see are due to chronic or repetitive trauma. Some are due to specific traumas. If you fell down the steps, tweaked your back, or you were in an auto accident or whatever, and damage has been done, and it takes time and repetition to retrain joints, retrain muscles, that sort of thing. Now, by way of background, I'm the co-author of a number of clinical best practice guidelines for the chiropractic profession on neck pain, low back pain, chronic low back pain, and we just published chronic pain. And those guidelines typically recommend trials of treatment of between 6 and 12 visits over 2 to 4 weeks. I tend to be conservative. I usually tell people, give me 6 visits. Let's see what we can accomplish. If you're better before the end of 6 visits, I'll release you. I'm done. But if you're not, then we need to continue to treat. And it's not just that your pain's gone away. You can accomplish that with pain medication. It's that we've restored normal motion and normal function to the joints, and things are back to working like they're supposed to. So some of my colleagues may recommend to you much more extensive initial treatment plans, 30, 40, or however many visits. All I can tell you is there's no good literature to support that approach. My approach has always been, let's just do things in small, short chunks of treatment. If we're getting better, we keep going. If it's not getting better, then I'll either try something different, do some other studies like x-rays or MRI or something else, or I'll get a consult or refer you somewhere else. If you've gotten better and we've continued to treat, I'm going to release you at the point in time where either you plateaued, meaning it's just not going to get any better, or you're better and we're done. And then off you go. Now, many of my patients have chronic recurrent issues because the stuff that got them into trouble, they're still doing. They're working at home on a lousy pseudo desktop on their laptop, which is, by definition, the monitor's in the wrong place, should be up here, not down here. They're reaching too far for their mouse. The desk height's too high or too low, so their shoulders are up by their ears all day long. And, I can help that stuff, but if you keep doing it, it's not going to resolve. So some people do great after a trial of chiropractic care, and then it's kind of slowly returns. Those people need chronic care, and that's certainly a reasonable approach as well. So anyway, I hope that helps address the question of why do I have to keep coming back?